Dawn Behrend. I'm an instruction and outreach librarian at Lenoir-Rhyne University. We're located in Hickory, North Carolina. And I'm a second career librarian. I've actually just kind of come into the field in the last few years, and I've been a licensed psychological associate for over 20 years. I still work in private practice, and a big piece of what I do is psychological testing to provide people with a rule out of the diagnosis of autism spectrum disorder.
And I'm Patrice Hall. I'm the health sciences librarian. I've been here at Lenoir-Rhyne for about 6 years, but prior to coming here, I was a consumer health librarian at the Lois High Bursler Community Health Library, part of Penn State Milton S. Hershey Medical Center. I was there for about 15 years.
Okay. So I guess we'll just kind of launch right into our presentation here. So we're talking about how can you assist library users who are on the autism spectrum and also help their caregivers to find information and whatnot. So to start out with, we're just going to kind of provide you of a definition of what autism spectrum is according to the American Psychiatric Association. It's a complex developmental condition that involves persistent challenges in social interaction, speech, and nonverbal communication, and restricted repetitive behavior. So the kind of thing to keep in mind is that it's a neurodevelopmental issue that is present throughout the lifespan. It's not something that goes away, although a person can gain better control over the symptoms with age and maturity and things like that, and the right supports. In terms of prevalence, the CDC has said that 1 in 59 children have a diagnosis of autism spectrum disorder. And there's some characteristics of autism spectrum disorder to be aware of. These go along with the diagnostic criteria that we use. We use something called the Diagnostic and Statistical Manual of Mental Disorders. I wasn't going to give you the complete criteria blow by blow, but just to tell you there's a couple of pieces to the diagnosis that fit people who are on the spectrum to some extent or other. Although it is a spectrum, to have the diagnosis, you have to have these impairments at some level. So the first piece of the diagnosis is social communication challenges. So people with this diagnosis have trouble with social emotional reciprocity. And what that means is it's hard for them to have a back and a forth conversation with somebody. They may want to talk about just what they want to talk about. They may interrupt a lot, things like that. And they may not be able to take the other person's perspective or really kind of reflect back to them that they understand this person's thoughts and feelings. Another part of this is the use of nonverbal communication. People on the spectrum tend to struggle with things like eye contact, making facial expressions, using gestures. That's something that they don't often use to supplement their communication. And then developing, maintaining, and understanding relationships is a challenge. There is a stereotype that people on the spectrum just really aren't social, they don't want to have friends, and often nothing could be further from the truth. They're actually highly social, they really desire those relationships. They just don't know how to go about the ins and outs of it. So they may easily make friends, but have a hard time keeping those friends. Or they may be able to make friends with people at a different developmental level than them, but have a hard time keeping relationships with people their age or older. And the next part of it we see is the restricted and repetitive behaviors that go along with the diagnosis. So often people on the spectrum will make repetitive movements with their body. So they might do things we call stimming behaviors, like moving their hands in a particular way, rocking, maybe walking on their toes or spinning, things like that. They tend to have very narrow or extreme interests in very, very specific topics. So they may want to tell you all the statistics of their favorite team or tell you all about the Titanic or their favorite dinosaur, and not really have a lot of interest in talking about things that don't have to do with that interest area. It's a lot of insistence on sameness. They like the routine to be the same way. They have a hard time with transitions when things aren't going the way they're planning for it to go. That can be very hard for them to make that. I often tell my clients it's like switching gears. It's hard for them to do that. Another piece of it is they can either have hyper or hypo reactivity to sensory input. So a lot of times people on the spectrum may have something like a sensory integration disorder. So they may really be sensitive to smells, lights, sounds, different things that other people may not even notice to them are really bothersome. Other people are seeking out the sensory. You may see them putting things in their mouth or touching things or even wanting to come up and hug people. So they really want that sensory input. So it can go either way. One term to kind of throw out there is something called neurodiversity, and that symbol is the awareness symbol for that movement. And there's a national symposium on neurodiversity at Syracuse University, and they define neurodiversity as a concept where neurological differences are to be recognized and respected as any other human variation. So there's more awareness that people are not always the same in how they see the world, and that's okay. People on the spectrum may really not want treatment or to change. They rather would have some accommodations for the things that are challenging for them. So there's the term neurotypical for what, you have people that are more in the norm, and then there's neurodiversity on the other side of that. So, people on the spectrum have a lot of strengths. Although they do have challenges, there's strengths as well. And there's a picture here of Temple Grandin. She is a professor of animal science, and she's a well-known spokesperson for autism. She herself has autism. It talks about what it's like to have that diagnosis. And, people on the spectrum really do have a unique view of the world. They see things differently. They can be very straightforward. They can be very persistent. Once they're on a task, they really kind of stick with it. Very detail oriented, and they really thrive on routine. So they do really well in a structured setting or a job that's really detailed. So that's something that is a real strength for people who are on the spectrum. And I keep using the term on the spectrum, and I should mention that, especially with the idea of neurodiversity, people can have features of autism, but it's not a disorder unless it's impairing the person in some way. So, so that's where it's okay to have these different ways of seeing the world, but when it impairs you, it becomes a disorder and something that maybe could be worked on in counseling or whatnot. As far as challenging behaviors that you might notice in people that are on the spectrum, sometimes they stare inappropriately. So a lot of times they've gone through some kind of social skills training where they're taught to make eye contact, but they can't really mesh it. They can't really do it seamlessly. So they're either kind of looking away or just staring at somebody. And other people in the library may think that that person's being inappropriate, that they're staring at them. So, and it may make you as a librarian uncomfortable if you're having a reference interaction and they're just kind of not breaking the eye contact, but just to be aware of why that's happening can be helpful. They may tend to speak very loudly, not being aware of that. Respecting personal space can be an issue. So like my funny picture here of Seinfeld and the close talker, they may get really close to you and maybe even try to hug you or touch you or things like that. So that can be a little hard to manage sometimes. They may be overly blunt, so what people may take that as being kind of rude. They just say what's on their mind without, sugarcoating it. You may notice patrons that are bothered by what seem like pretty minimal sounds covering their ears or coming to you to complain about people being loud or things like that. They may engage in self-stimulating behaviors, so you may see things like rocking or finger movements or flapping. And sometimes, or a lot of times, they really just don't understand social dangers or risks, so they may leave their computer on their laptop on a table and just walk off, or they may do things that people ask them to do without thinking about the consequences of that. So those are some of the challenges. Now, when we talk about, autism spectrum and the college years, so, 50,000 Americans with autism disorder do reach adulthood each year. And of those people, a third of them enter college. So another stereotype that used to go along with autism, probably not so much now, but there used to be a stereotype that if you had autism, you had an intellectual disability as well. And that's just not the case. You know, there's some people do, but others are really, really high IQs, or at least average, you know. So more and more are entering college. But what we find is that it's hard for them to complete college successfully. So fewer than 20% of students graduate or are even on track to graduate college 5 years after high school. And I have a citation for that study there. So it really becomes important to help retain those students and have them be successful in reaching their potential. And we see here that nearly half of 25-year-olds with autism have never held a paying job. So these other statistics I put on here come from the website Autism Speaks, but as a library, we can really offer services to help those students be successful and like I said, reach their potential. So the reasons why it may be challenging for students on the spectrum in college and making that transition is a lot of them had formal education plans when they were in high school. So these were very specific structured plans called IEPs that made sure they received accommodations. In college, there are student support services and they get some general accommodations, but not to the extent that they did when they were in high school. The complexity of their social interactions has increased. Students on campus are, they're getting more mature, more independent, and they expect more in their interactions. It can be hard to meet that expectation. There's a lot of sensory load. If you work on a college campus, which I'm sure all of us do, there's, just walking into a cafeteria or a dorm can just hit you with all kinds of sensations, and it can be hard for them to take that in. There's a lot of transitions. They have to change classes. They're not going to have the same exact schedule every day. There's more group work, which can be challenging. And they may be used to having somebody like a parent that's there for them and organizing and structuring all these things. And now that person's not there on a daily basis. So all those things can put them at risk for early dropout from college. So that's where we kind of come in, or do our piece as academic libraries. What can we do and why should we? Libraries are known for being inclusive places. We're part of the community. So we're trying to make a place that everybody can receive services and access what they need. And there's the idea of library as place. Again, we're part of the community. It's a place for people to come, to be comfortable, to feel safe. And so we have a role in that. And also there's some federal mandates. There's the Americans with Disabilities Act and the Individuals with Disabilities Education Act that put us under, what am I trying to say, requirements there. So those are some of the reasons why it's important to be aware of autism spectrum and what we can do as librarians. So some tips for interactions. This is not comprehensive by any means, but just some ideas about what to do if you're working with a student or even a faculty member on the spectrum. One thing you can do is structure your communication. So let them know what you're doing, what's coming up next, and why. So they really kind of like to have predictability. What are we doing? Allow them to have time to process what you're telling them. So don't expect an immediate response, and they may not give you a lot of clues that they're processing it or even thinking about it, but just give them that time. Be very clear and direct. Try not to use sarcasm or figures of speech or a lot of, you can be humorous. If people on the spectrum have a sense of humor, but they may not get more subtle figures of speech or things like that. Gestures, try to use a minimum of that, or especially don't depend on that to supplement your communication. They may not always understand that. Be willing to repeat or clarify yourself, what you meant, be very concrete, very direct. People on the spectrum tend to understand visual information a little bit better than verbal. So if there's a visual way to show them what you're doing, that's helpful. And using closed-ended questions can help in a reference interview just to kind of keep them on track, especially if it's something they're really interested in and kind of want to go off on a tangent about, that can help kind of pull them back in and keep them on focus. Students in the classroom, that's a whole other thing when we're doing library instruction sessions. How do we kind of work with the students in the classroom? So kind of like the reference interview, just giving them some kind of boundaries and expectations, setting forth what we're going to work on today. This is what we're going to do, and and that's helpful for all students, but especially for students on the spectrum. If there's a lot of, persistent questioning, maybe they're wanting to really drill down on a topic that's not particularly relevant, just kind of gently redirecting that, or maybe offering to meet with them after the session can be helpful. Try to help them understand the big picture. So one thing that goes along with autism spectrum is they can be really highly intelligent, but not kind of see what the point is, or the overall message. So they might really be hung up in the details, but not what does it mean. So having that supportive presence to kind of explain to them what the concept is can be helpful. One role we can have is if we can interact really respectfully with these students, it role models that to their peers so that they can kind of understand how to interact better with them as well, and increases awareness. Just be aware that group work can be a challenge, so maybe give them the opportunity to work individually if that would be better for them, and maybe not force them to do the group work activities, or if they are doing group work and having difficulties, kind of intervening and helping to smooth that over. And just be aware that we know we're big on technology and libraries, but that can be a sensory overload for students on the spectrum, so just knowing that. And then I have a link here that is a Universal Design Learning link. It's a technology tools for students with autism. So they have lots of good ideas on there that you can take a look at when you have time, when these will be posted later. Library spaces, again, just being aware of sensory overload. There's probably not a ton you can do about it overall without a major remodel, but just being aware that if your lights are super bright, or if people aren't respecting the quiet space or whatnot, or if there's a time of day when it's really busy and more loud, that could be a trigger for some of these students. Try to provide clear signage so they kind of visual. Here's an example here that you can see that another library uses that gives them very clear guidelines and a visual of what's expected in each space that they're in. Give them those quiet spaces. They really like things like study carrels or private study room, or a place that they can really have to go to if they're feeling overwhelmed. And give them handouts of the policies and the rules so that they, once they know the rules, they tend to follow them pretty closely, but they may need that where they can really see what the expectations are. And then library programming, some ideas that you can do there are, having some social groups for them to participate in. So maybe hosting a group on a special interest topic, maybe trading cards or Pokemon or something that they are interested in. And that way the library is not just a place for them to go and escape, but it's a place where they can kind of socialize and practice their social skills and come and do that and make new friends. Providing convocations for students and faculty can help increase awareness on autism spectrum and improve their interactions with students and others on the spectrum, make it a more welcoming environment. Trainings for library staff and student library workers is helpful, just like we're doing today, to help them understand people on the spectrum and how to interact with them. And then there's World Autism Awareness Month coming up. That's every April, and that's an event that you could maybe do some programming around to try to raise awareness on your campus. And then finally, some community partners that you might not be aware of. As like I mentioned, I'm sure everybody knows on every campus there's a student support services. So they do things like provide accommodations or maybe some counseling services offered. But there's also local mental health providers that are available. And so maybe having a list of those and having it available as a referral source for students could be really helpful to have. Voc Rehab, vocational rehabilitation, is a federal program. It's in every county throughout the state. They can work with all age groups, well actually 16 and up, but it's as far as they don't age out of it. A person with any kind of diagnosis, it could be something like ADHD, they can get services, and their whole goal is to help somebody reach their employment goals. So if somebody's in college, they can help make sure that they're doing, they're taking courses that match their career interests, that they are maybe help pay for their tuition. They can help get them ready to do some job training along the way and just get them ready to finish college and get out there in the workplace. It's a great program. Support groups, becoming aware of what support groups are available in your community and having that available as a referral source. The last two are more, maybe if somebody has Medicaid or something like that, if they qualify for those services, they can get care coordination. So and the Department of Social Services can help as well. They can coordinate things like transportation, housing, food. So if you have a student who is maybe lower income and is really struggling with these things, then those are a couple of community resources that could be helpful for them. And they may not even realize they qualify for it. So maybe helping them understand how to apply for those benefits and services can be helpful in terms of them staying in college and finishing. So does anybody have any questions for me before I turn it over to Patrice? Or no?
Anybody have questions, please type them into the chat room.
Okay. And if not, I'm just going to go ahead and turn it over to Patrice, who's going to talk about consumer health information.
Okay. Yeah, so I'd like to just take a few minutes to talk about consumer health, providing consumer health information in general, and then look at some good resources for finding reliable consumer health information on autism. So providing consumer health is a little different than providing reference services that you might be used to when you're working with students on a class assignment or helping faculty with their research. Consumer health is when you're providing information for someone's personal use on a medical issue or a health issue. And this might be a parent or a caregiver, or even, if you have a student who is on the spectrum and who might come in and they're looking for information for themselves and not necessarily for research purposes. So, no, I went too far. There's some extra challenges in providing consumer health information. One thing, of course, is emotion, the emotional aspects of it. Now, we're used to students coming in. They might be a little emotional because their paper's due and they haven't found those peer-reviewed resources yet. But, when you're talking about someone's health, or someone comes in and they're worried about the health of their child, it's a little different set of emotions there. And of course, with providing reference, confidentiality and privacy is always important. But with the health information, it's extra important. In university hospitals or in a hospital library, they're guided by the HIPAA regulations. But even in, an academic setting, in a public library setting, it's more just the ethical component of, keeping this information private, not sharing it with your coworkers or going home and talking about it. Some of the other challenges with the consumer health is the complexity of the questions you might get asked, the health issues, and the terminology. The medical terminology can also be challenging. And then there's the whole issue of health literacy. And I could spend a day talking about health literacy, but low health literacy is very common. The National Assessment of Adult Literacy was a study that was done by the National Center for Education Statistics. It found that only 12% of adults in the United States have proficient health literacy skills, and that 14% of the adults in the U.S. have below basic levels. And also, not only, even if you're dealing like a faculty member comes in, they might be the best person ever to talk about medieval literature, but when it comes to the health issues, they might not have the understanding that they would have with other topics. And that's just something to keep in mind, because it's a challenge to find understandable, health information on an understandable level. And just walking the fine line between explaining what this information is or evaluating this information and providing an opinion on it can be tricky. The other challenge might be, not all librarians are familiar with the resources or might not feel comfortable providing that kind of information. So some tips about dealing with some of these challenges. This is from Beyond an Apple a Day, which is a really informative course from the National Network Library of Medicine on how to go about providing consumer health information. And these are some of the tips that they give, the idea about being empathetic and being an active listener. So you want to really focus on the person. you want to say, you know, things like, well, you must be worried, or you know, be understanding, but you know, not to avoid sharing your personal experiences. You don't want to do that. And it's interesting, one of their tips is to use the open-ended questions to elicit more information from the patron. And that kind of contradicts what Dawn was saying about when you are dealing with someone on the spectrum, open-ended questions might not work. So it's important to keep in mind, if you are working with someone on the spectrum, to keep in mind that the tips she gave, because they might not, you might need to mesh those with some of these tips. But again, to respect the privacy and confidentiality, looking for those emotions, to be aware of your body language, and also to know your limits and the limits of your collection and your access to information. And then not to be afraid to refer the patron back to his or her healthcare provider, because that's one of the key things is, you know, you don't want to be giving the medical advice, or you don't want to be giving an opinion. And this can be difficult, because I used to run into this a lot as a consumer health librarian. You get a patron come in and they'd say, well, what do you think? You know, who's the best doctor for this? What should I do? And, you know, what you can do is you just want to make sure you're providing them with the best resources that you have access to, and then tell them, you know, take this information, go back to your healthcare provider, go back to your doctor, and discuss it with them. And in regards to the autism spectrum disorder, you know, like I said, you know, all medical health issues can be complex, but this is a very complex condition. And part of the challenge there too is there's no definite answer yet, no definitive answer on what causes this condition. And also, like Dawn was talking about, you know, the range and severity of the symptoms. You know, not everyone is on the spectrum is exactly the same. And this kind of complexity, it makes a condition like this very susceptible to fads and to cons. You know, parents are desperate for information. They're desperate to find out, you know, what can I do to help my child? And also, even the media can play into this too, because they can you know, a lot of the information you'll see in the media could be incorrect. A study that was published in 2016 by Schreck and Ramirez found that they had looked at, like, I think they had looked just at like the NBC, CBS, and ABC, the networks. But their study found that 70% of the information that was given on the news broadcasts for those major networks, that 70% of that information focused on non-evidence-based treatment. And the other problem too is even treatments that are available, you know, there might be a promising research, but it'll be oversold. So there's a preliminary study has come out, and it sounds promising. It might turn into something, but it's not a cure. It's a long way from a cure or even a treatment option. And then the treatments that are out there, there might be treatments, for example, like the diet interventions. They might work to help some symptoms, some behaviors in some patients, but it's not a cure-all. But a lot of times in the media, it'll be like, oh, you know, this is what's going to cure you. So that's why it's important to really keep focused on those evidence-based resources whenever you're dealing with consumer health, and particularly a condition like the autism. You want to avoid going down the rabbit hole. So I don't know, will my links work? Will they show up?
Yep.
Yay! So my number one go-to, when I was a consumer health librarian, my number one go-to resource was always Medline Plus. The breadth of coverage, the ease of the navigation, and the quality of the resources is really outstanding in Medline Plus. So you can never go wrong going to Medline Plus as a starting point anyway. Another good site, particularly with anything doing with children, is the Kids Health, and I like this one. It's got, so like if we do autism, you can see it always has it'll have 3 sections, so that it has information, you know, for the parents. It's got one written focused more on teens, and then one that's focused more for information for younger kids. So it's a really good site for that. It's up to date, and the information is very authoritative. So it's another good evidence-based site. The CDC has a good site for the autism spectrum disorder, and it has it goes from consumer health level, and it does have articles that get more up to the professional level, the provider level, but it really has a lot of good information on it. And then the Cochrane Plain Language Summaries. This is sort of a little bit of a different beast, but because even though it says plain language, it's really not all that plain. But if you have a patron and they want to look, if you're trying to, look at, what research has been done and what except I spelled it wrong. Give me a chance here. Let's go back. Let's start over and try to type correctly. So this is a good site to see, what research has been done, what research is out there. And the plain language summary, if any of you are familiar with Cochrane, Cochrane is the gold standard as far as systematic reviews. And the plain language summary that they put in, theoretically it's for community, but it can still be a little tough going. But it's great because, it'll review, what the studies are, what studies have been done, and it'll, what the results, what did these studies find, and also what was the quality of these studies. So you can see in this one, they only found one study on the chelation therapy, and even that one study was not a real good one. So like I said, if someone comes in, and you're really looking for the evidence base, what studies have actually been done, that's a good place to go. And then the clinicaltrials.gov is really good if you have someone that comes in and they're looking for a clinical trial. Maybe they want to find out if there's one that they can join. You can always go to the clinicaltrials.gov. And it's pretty easy to search if you're just doing a real basic one. So let's see if I can type this correctly. Yeah, why can't I spell all of a sudden?
Oh yeah, you didn't.
Why can't I type? It's late in the afternoon. It's not even that late.
It's 1:30.
Yeah, I know. I'm old. It's my bedtime. There it is. So there we go. So now we're doing better. Now we have 906 studies.
Wow.
But it can show you, if something's recruiting, if there's a study recruiting, you can get a lot of information about, how you could sign up for it, or how someone could enroll in it. And then it also has information about trials that have been completed. A lot of times they've been completed, but they still don't have the results published. That's another whole issue in the evidence-based world is clinical trials that don't publish because the findings might have been negative and they never publish. And then just another resource that's good that I think everybody should have, if through NC Live, the Gale Virtual Reference Library. I used to use that. I had, I was actually in Pennsylvania, so I actually had but I had my own little collection of the Gale Health Encyclopedias. And I found them useful, that they were a good source for an understandable overview of a topic. Most levels with the autism, I think I had looked, and most levels in the autism were the intermediate, but that's still not too bad. And it's a nice source that, like, if you have a patron come in, it's something you could print out and give to them so they have something in their hand. You just have to watch the dates because some of the encyclopedias are getting a little out of date. But it is a good resource that's available. And then our last slide here, I think we've got, these are some of the websites that are out there that are useful. And it's kind of funny, the Autism Self-Advocacy Network, and then there's the Autism Speaks. And those are two, like the first one there, that's the one it's very into the
diversity.
Thank you.
Neurodiversity.
That Dawn was talking about. And then the Autism Speaks, it's one that's more research oriented, and it's looking more like at treatments and, can they figure out how to prevent it, things like that. And then the National Autism Association, it's got some good tools for, it's got like some safety tools, keeping children safe on the spectrum, things like that. And then those last three, these are ones that Dawn had that that are good, have good tools and some ideas for dealing with the autistic patrons and doing programming and things like that, being more inclusive in the library for those. So, is there any questions for either of us?
If anyone has questions, please put them in
You
the.
can unmute yourself
chat.
if you just want to talk.
Yep.
Speak up. And oh, and our very last slide too, we do have, these are just, and this is sort of a mishmash. It's got some professional level titles, and then it's got some consumer health books that are good. Any questions? I know I talk fast, so if you want me to do it all again, I can.